Hi everyone, my name's Gina Ganella, your on-site Florida Blue wellness consultant. Today we're going to be discussing back health. How many of you have had back pain at least once in your life? Probably a majority of you. Back pain is one of the most common reasons people go to the doctor or miss work, and it is a leading cause of disability worldwide. Fortunately, you can take measures to prevent and relieve most back pain episodes. Today we're going to discuss the basic anatomy and mechanics of how your back works, behaviors that may cause injury, ways in which you can keep your back healthy, and we'll learn some exercises to release tension and strengthen our back. If you have lower back pain, you're not alone. About 80% of adults experience low back pain at some point in their lifetimes. It is the most common cause of job-related disability and a leading contributor to missed work days. Back pain includes lower back pain, middle back pain, upper back pain, or lower back pain with sciatica. Nerve and muscular problems, degenerative disc disease, arthritis, and injuries can result in back pain. Most low back pain is acute or short-term. It lasts a few days to a few weeks and resolves on its own with self-care without residual loss of function. Most of acute low back pain is mechanical in nature, meaning that there is a disruption in the way that the components of the back, the spine, the muscles, the intervertebral discs, and nerves all fit together and move. Chronic back pain, however, is going to be defined as pain that persists for 12 weeks or longer, even after an initial injury or underlying cause of acute low back pain has been treated. About 20% of people affected by low back pain develop chronic low back pain with persistent symptoms at 1 year. Conditions commonly linked to low back pain include muscle or ligament strain, bulging or ruptured discs, arthritis, skeletal irregularities, osteoporosis, and sciatica, which is a common cause of pain affecting the sciatic nerve, a large nerve extending from the lower back down to the back of the leg that may cause back pain or a pain and burning in the rear or the leg. Let's get the lowdown on the spine so that we can better understand how injury to the back occurs. The spine is made up of 33 bones called vertebrae. Shown here are the 24 movable bones, vertebrae, that are separated by discs, and the 9 fused vertebrae that make up the lower portion of the spine. They provide protection and support for the spinal cord and nervous system. The cervical curve is in yellow, which shows 7 vertebrae. Thoracic curve in blue shows 12. The lumbar curve in green shows 5. The sacrum has 5 fused vertebrae. And lastly, the coccyx in coral shows 4. Separating each vertebra is a cartilage pad-like cushion known as an intervertebral disc. Openings in each vertebra line up to form a long, hollow canal, which the spinal cord runs through from the base of the brain. Nerves from the spinal cord branch out and leave the spine through the spaces between the vertebrae. Arthritis and osteoarthritis can affect the lower back. In some cases, arthritis in the spine can lead to a narrowing of the space around the spinal cord, a condition called spinal stenosis. Spinal stenosis is when the space between the bones that make up your spinal cord, called your vertebrae, get narrow. This can put pressure on those bones and on the nerves that run from your spine to your arms and your legs. It happens most often in your lower back or your neck. The ligaments, cords that surround or hold your spine together, may get thicker and harder as you age. Bones and joints may also get bigger, and that can narrow the spaces between your vertebrae. Arthritis, which is more common when you're older, can make this worse. Several things can put pressure on your spinal cord and nerves, such as a herniated disc, the soft cushions or discs that separate your vertebrae, the crack and ooze. Tumors can also grow in the spine, or a sudden injury can shift your spine or create bone fragments there. The spine's vertebrae are held together by ligaments and muscles, and they are attached to the vertebrae by bands of tissue called tendons. Every time you bend over, lift a heavy object, or sit leaning forward, you put stress on your spine. So over time, the discs between your vertebrae can start to wear out and become more damaged. Conditions commonly linked to low back pain or back pain include muscle or ligament strain, bulging or ruptured discs, arthritis, skeletal irregularities, osteoporosis, sciatica. We're going to review the different postures on this slide. The spine curves naturally at 3 places. When sitting or standing, the correct posture, these 3 natural curves should occur. The upper portion of the spine is the cervical, the middle portion is the thoracic, and the lower portion is the lumbar. Mind your posture. If you are one of the many people who suffer from back pain, it's important to pay close attention to your body. When people are aware of their posture, they tend to decrease the intensity of their pain when they make subtle changes. The left 2 images, her head is dropped and shoulders are rolled forward, rounding the upper back. which means it's an over-exaggerated of that thoracic curve. And she's pushing her hips, meaning weak abs, and knees forward, causing this over-exaggeration of the lumbar curve. This is a lot of strain on the neck, upper back, and lower back. Those second images, her ear is lined up with her shoulder, hip, and knees, allowing the natural curve of the spine and reducing stress. It's also important here to recognize that there are certain things that we wear that negatively affect our posture, such as high heels and a wallet in our back pocket, as well as looking down at our cell phones. Hunching over may make our back pain feel better for a short time, but it is only straining our spine more. There is also a risk that your vertebrae, or small link bones that form your backbone, could fuse in a bent forward position. If your job requires you to stand, pay close attention to the way you distribute your weight on your feet. It can be helpful to engage your core muscles throughout the day so that you can take some pressure off of your low back. Your back could also hurt due to repetitive tasks. No matter how good your posture is, it's important to make small changes in your posture throughout the day. If you sit mostly, get up and move each hour. If you stand, shift your weight from foot to foot periodically. Let's review correct sitting posture. Our monitor should be in line with our head and our neck, not tilted forward or up. Our arms should be at a 90-degree angle, where our wrists are resting level on a surface. Our feet should be flat on the floor with a 90-degree angle at the knees or on a footrest. And lastly, for lumbar support, our shoulders should be in a straight line with our ears and our hips. If you must sit at work, choose a chair that's supportive of your low back. Chairs with lumbar support can be especially helpful. Do not sit in a chair that is too high. Your feet should always be on the floor or on a footrest. Be sure your back pockets are empty so your rear is balanced evenly. Most importantly, take time to get up throughout the day. You should also do occasional stretching. Your back could also hurt due to repetitive tasks. If your job requires you to sit at a computer, it's important that you have all of the peripherals at an appropriate height. And if you work with a telephone while sitting at a computer, use a headset so you don't have your neck at an awkward angle throughout the day. If you must lift heavy objects, it's important that you do it properly. You might be tempted to lift from a bent posture using your back as the fulcrum. This will put unnecessary and excessive pressure on your low back. Instead, use your legs and your core muscles. First, you want to squat down to pick up the object, then lift from that position. Next, hold the item as close to your body as possible. If you can't lift the object from a squat, find someone to help you lift it. And third, it is important to not twist while you're lifting a heavy object. Even our posture sleeping can impact our back health. Our pillow should not be too high or too low, our mattress not too soft or too hard, and use a knee pillow to reduce angle from our hip to our knee on one side, or under our knee to reduce strain on our low back when sleeping on your back. Eating healthy food and watching your portions can control your weight, and that's important. Extra pounds mean extra pressure on your spine and your joints. ChooseMyPlate.gov is a great resource for determining how much you should be eating and the quantities from each food group. The primary cause of inflammation is poor diet consisting of processed foods that our body stores as sticky stuff in the blood and in tissues. Our immune system doesn't recognize the sticky stuff, so it attacks it, trying to get rid of it, which causes inflammation. While there is no one diet that is recommended for chronic back pain, foods with anti-inflammatory properties, such as those high in omega-3 fatty acids, fatty fish like salmon, herring, mackerel, or sardines, could help. Other anti-inflammatory food include broccoli, peppers, mushrooms, tomatoes, olive oil, green leafy vegetables such as spinach, kale, and collard greens, nuts like almonds and walnuts, fruits such as strawberries, blueberries, cherries, and oranges, green tea, turmeric. Veggies and fruits are hydrating, just like beverages. Aim to make half your plate produce at meals. Vegetable and fruit servings will supply water as well as a hearty dose of vitamins, minerals, and fiber. Some fruits and vegetables are more than 90% water, including cantaloupe, strawberries, watermelon of course, cucumber, celery, lettuce, leafy greens, zucchini, tomatoes, bell peppers. Sipping water with meals will help you eat more slowly, pace your eating, and of course, stay hydrated. The lack of proper hydration could affect your back and could be a cause of back pain. The muscles in your back can become stiff and sore when you haven't hydrated enough, and stiff muscles can lead to painful muscle spasms or even slip discs in your back and your neck. Drink at least half of your body weight in ounces of water each day to stay hydrated. Even more if you're physically active, in a hot climate, have certain chronic health conditions like diabetes, or are taking certain medications. You can lose 3 to 4% of your body weight through dehydration without feeling any symptoms, but once you lose 5 to 6%, you'll start to feel the symptoms of mild dehydration, such as thirst, headaches, fatigue, dizziness, or even constipation. Exercise is an important part of everyday treatment. When you strengthen the muscles that support your spine, you can boost your flexibility and lower pain. Physical activity increases the mobility and reduces pain for people suffering from chronic back pain. Exercise is the best way to increase nitric oxide, which is a chemical messenger that prompts the body to make its own medicines, including anti-inflammatory and pain relievers. The National Physical Activity Guidelines recommend at least 150 minutes per week of moderate activity, like walking, cycling, or swimming, and include strengthening and flexibility activities. You may need to start with a physical therapist if you've had a diagnosed condition or a personal trainer to learn the proper exercises and correct posture. If you have questions, follow up with your PT and your physician with specific questions regarding your back pain. Additional resources can be found at gatorcare.org or by contacting Employee Wellness at wellness@jax.ufl.edu.